divided like into different regions. So if you can think of deanery as like different regions in the country, could be in England, it could be in Scotland, Wales, Northern Ireland, but just think of it that way. So in England, I've listed the number of the deaneries that we have. For instance, you have the East Midlands, you have East of England, you have Kent, Surrey, and Sussex, you have your London deanery, North East deanery, Northwest, which is the deanery I'm from, and the list goes on. And then you have, I think for Scotland, Wales, and Northern Ireland, when I checked, it's not necessarily, they don't have as many training regions as England. So the posts also will be quite few. So these deaneries like would actually publish, I think there's actually a list on the website. They'll publish a list of the available posts possibly that they'll have for the year. Sorry, just doing a house check just because I was looking at the chat. How is everyone following me? Is there any issue at the moment? Okay. I'll just continue. I can't see a reply on the chat, but I just need to be sure that you're actually following. Okay, fine. Fine, I'll continue then. Thanks. So these deaneries, like I said, would show like how many trainees they'll take for the year. That can really be modified or be changed during the offers period. So don't really bank on it. Just have a rough idea actually of what exactly how many trainees they are going to take. And then there are some dedicated IR posts. So now there are actually dedicated interventional radiology posts, which if you get onto, you are basically on the interventional radiology pathway. The training is still pretty much similar to the other trainees, but in that one, you know that what you're going to CCT in is like pure interventional radiology in whatever aspect that you eventually choose. So the training scheme is like could be an academic system or a traditional system. Academic system means that they are like dedicated schools, I would say. So it's an academy, it's like a classroom setting, not in the main hospital where group of trainees go. You are taught things that you should know, that you should learn as much as possible. It's like simulating being in a hospital environment. And then the traditional one is just in the hospital. Now the reason why, or one of the main reasons why they started the academy from the RCR website was to basically fill the gap of having more trainees within deaneries. So I'll give an example. For our ST1 currently, we're divided into 3 blocks at every unit time. So 1/3 of us will be in the academy, which means there's less pressure on the hospitals. The hospitals have a fewer number of trainees which they can actually accommodate to train properly. And then you keep rotating amongst yourselves. So I started with the academy, for instance, and then I'm in the hospital now. And then another group is currently in the academy. So that frees up space for more trainees potentially. Um, it's actually very good learning in the academy environment. You taught a lot actually. And then the purely traditional style, I would say, is there is no academy. But there's push now to actually have these academies, I think, in a lot of the regions across England. I've listed the current ones that we have, just giving a list for information's sake. But yeah, I think that's a summary of how I can describe it. So what's the actual structure itself? So for those that may have trained here in the UK, there's the foundation training, doing your FY 1 year, FY 2 year. Those that may have trained in other countries can also have like a foundation equivalent kind of training. Now, the whole idea is you have a CREST form, which if you've applied and been able to write the MSRA, I assume, was accepted already for the sake of specialty training. So that's the FY1, FY2 part of it. And then if you get the job, the training itself is 5 years training. From ST1 to ST3 is focused on core radiology training. So it's like you need to know everything, basically. I would say like a general radiologist. So emergency and the various subspecialties, you have a good knowledge. And then from ST4 to ST5, you start like gravitating towards your specialty interest. So for instance, let's say I want to do gastro. I want to be a GI radiologist. From ST4, I will spend like 40% of my time doing gastro and 60% doing general. And then ST5, I can switch it, or they switch it, 60% doing gastro, 40% doing general, and then you CCT and become a consultant. If you are going to be doing like pure interventional radiology, which could be vascular radiology, neurointerventional radiology, you would need an extra year. It's kind of like a fellowship year, but basically as an ST6 year, where you would sub specialize like into the interventional aspect. So it could vary between 5 to 6 years, basically. That's how the training goes, and this is from the RCR website. Are there any questions at this point, or should I continue? Okay, fine. Now to the meat of this presentation. I put the competition ratio here. I was just having a look at it actually from some of the official sources, and it's basically changed from about 3.6 applicants to one post to 11.9 last year, which means it's getting quite heavy. It's very competitive. However, I think you should just take a deep breath. It looks this way, but you need to like not be focused on that. You need to be focused on your own self and your own preparation. And the reason I say this is I think the MSRA exams actually skews this competition ratio, which we will not, I don't want us to debate on the pros and cons of having the MSRA exams, but it does skew the ratio. Because if you get invited for an interview, for example, last year, I think probably, I don't know the exact number, but let's say 800 of us or 700 plus were invited for the interview, and they were like short, maybe below 350 positions. So that actually reduces the ratio. If you look at it that way, you should always look at the positive part. That reduces the ratio to roughly 2 point something candidates per post. So I think like you need to not interpret, you need to look at it, but don't interpret it in fear and just focus on what you can control, basically. They've tweaked the way they select candidates this year, successful candidates. So last year, the MSRA was used to shortlist, and the cutoff was I think initially 554, 555, I'm not sure, but within that range, and then it was reduced to 549, I think, eventually. So that was used to shortlist, but that was also used as a percentage of our final ranking scores. So the MSRA was 20%, the portfolio was 30%, and the interview was 60%. So this year, the MSRA will be used exclusively for shortlisting, and then it's your portfolio and your interview. Now, I'm saying this because it's important to know that once you get an interview spot, all focus should be on maximizing that 60% from the interview. I think from my experience last year, that interview was really, really important in differentiating candidates because a lot of people probably landed on similar scales in terms of portfolio and the MSRA, but the interview was a big differentiator of people. So if you get invited for the interview, I think it's worth giving it your best shot. Even if you probably have 38% on your portfolio, don't relax. Don't think that assures you a spot. 60% is really a big deal to be able to use to make up and get an interview slot. And the interview itself is divided into two 10-minute stations. Now, going from the official website, they said that this year it's going to cover different criteria from the person's specification, and this will assess commitment to specialty and communication skills. And that's all they said. Last year, that was the thinking. That was the general thinking of how the interview was going to be. And then a week to the interview, we were told that there was going to be a new station called Clinical Prioritization Station. So I put there, expect anything, but I didn't make that statement in terms of trying to get you scared. I think the basic preparation for the interview will not still change. Like it's still the same core preparation and concept of preparation over the years, really. And then we'll go through that like in more details. So it's going to be online. At least that's what they've said. I don't think they've changed. They'll change it to in person yet. In the website, it's still going to be online, and you would have like correspondence through emails that are clearly explained, so there won't be any ambiguity about how things will go. But just have an open mind to, in case there are any changes that are made this year, just have an open mind. And then how do I think is a good way to prepare for the interviews? So at this point, you've gotten the invitation to come for the interview. It's quite a lot to prepare for, if I'm being honest. There's quite a lot of new information that you will need to know, that you would need to be comfortable talking about. A lot of the things you probably see when you're preparing for the interview, you've never heard. At least that was my experience. A lot of what I had to learn, I had actually never heard. but they are not like hard. It's not hard. It's not like you need to cram anything, or you just need to keep looking at it, keep practicing. So in terms of resources, I've grouped it into, there were question banks, interview question banks. I think there were a myriad of question banks, to be honest. If on a personal note, I would say I used, just because I had already used the platform before, Medibody. So I used the platform for as my like main question bank, but I can't say I compared it to any other question bank. Or there was one I think I used briefly. It was called QSMed, but I didn't compare different question banks to tell you which was the best. I think most of the question banks have similar questions and approaches to the questions. So you're most likely going to get similar information from the question banks. So I'm not advocating for like any particular question bank, to be honest. I think one very important resource are the groups that you're a part of. Riga, for instance, will be a good one because, I mean, if you have similar people of similar interests preparing for the interview, then that's good. One I found very helpful was UK RST. I think if you're not a part of the group, you should try and be a part of the group, just because there's a huge number of radiology hopefuls and trainees there, and it's very difficult for any hot information to come about, and that group, you don't get the information from that group. And then at some point they're going to do sessions about the interview, like how to go about this interview. They're going to do like mock sessions. Just I think it's just a good group to be a part of, just to be sure that you are kind of abreast with what every other person is that is preparing for the interview is knowing. It's not good to be isolated this period. I know different people have different styles of preparing, but I think you need to know what is going on, because this one, an interview is not an exam, you know. It's not actually an exam. It's a competition in a way, but you shouldn't like you're not looking to pass an interview. You're looking to actually be appointed. So it gets the stakes quite high. There's no like, oh, I passed the interview. No, did you actually get the number? Which means you have to be very competitive. You have to know what your colleagues that are preparing for it are doing. So I've spent some time talking about this group stuff, but yeah, I think you really do need to be part of some group. And then there are courses that are available. I think there was it Radcast? There was a course from Radcast, but I think it's paid for. Not sure how much it was. I didn't actually get to do any course. You know, this preparation is it's still what will work for you eventually. So it still means what you're comfortable doing. But there are courses available that can also give you like a good insight into the interview. And I think part of what those groups and courses we do for you is mocks. They'll prepare mock sessions where you speak to radiology consultant, radiology trainees. You get an idea of how exactly you're doing and your weak spots and areas that you need to work on. So it's very good. Another way, effective way, I think, to prepare will be to speak with seniors, speak with colleagues, speak with seniors. So there are a lot of questions really that can potentially come out in the interview, and you may prepare your answers from your own personal point of view, but you can literally just have a chat with a senior colleague and they just bring like a very valid, like good angle to it that you didn't see coming, just because radiology as a specialty is quite niche. So a lot of information are going to be quite new to you. It's not like you've been exposed to it since med school, like maybe in surgery, things in medicine. So you actually need some insights from valuable insight from seniors, and you can bounce off your ideas through them. You can even practice with them if they're available. They give you very good feedback. And then I've put there practice, practice, practice. Now, to break that part down, I think I'll just go back to, let me just go back to this. So, when I said the interview was going to cover, when they said 2 stations, I'll give an example from my year. The first station was clinical prioritization, where they asked us, like, I'll just give an example. Let's say they put 5 different scans requests for you from the clinical team and ask you, if you were the one that need to vet these scans, how would you place these scans in order of priority? There's no hard and fast rule to the answers, to be honest. It's more of they just want to see how you are thinking clinically. So, for instance, you have a major trauma case, like major trauma, and then you have a scan for an acute PE for a patient. I'm giving an example. Now, if they ask you what scan, how do you think you would arrange these 2 scans? Now, that major trauma would depend on the kind degree of injuries, potential injuries to the patient. Like that's literally life saving. So you need to like explain and go through the process of why you think that scan should come before the PE one. Now, PE most times is a clinical diagnosis, and if there is no contraindication to starting anticoagulation, for example, the clinical team would start anticoagulation as per guidelines, and that's the treatment already. So it may look big, oh yeah, acute PE, you should do it as fast as possible, but I've just given you like a scenario where not really. It it's the management it changes is if to continue the anticoagulation or stop the anticoagulation. But that will also depend on the clinical context. They can paint a PE session to you, for instance, that can become very, very urgent. So what if there's a contraindication to anticoagulation for the patient? Let's say the patient has a brain bleed somewhere. Now that PE scan becomes more important. So there's no like hard and fast rule on how to answer those questions. It comes more from your clinical experience and just a systematic like approach. It's like you have these patients before you and you're thinking what's best for this patient and what's best for this patient. They gave a sample question in the website, the recruitment websites. If just check it out, you can just see like I think they put 5 clinical scenarios there. I think some people's questions were actually them being a clinician rather than a radiologist. So I've given an example of you being a radiologist trying to arrange scans, but some people were actually, I think, were giving management questions, like to actually manage conditions. And I think the example that was on the website is actually you managing conditions. So you can have a look, and the question banks have some sample questions and possible approach, but try to know that it could be anything. And basically, they want to see your logical reasoning around it. And if it makes sense, then it makes sense. So there's no like hard and fast rule on exactly how you answer those questions. Now, that was one part, and that was station one. That lasted for 7 minutes, the clinical question for me. And then the last 3 minutes was a question about radiology. So I think generally I would group the interview into If there's a clinical prioritization station, I'll group it into the clinical prioritization station and then radiology as a specialty. And then you as a person trying to be a radiologist. Those are the three ways I'll look at it. All the questions that you can possibly think of will revolve around those themes. And I don't think it's that difficult to eventually have an answer for every possible question they can ask you. And the reason I say this is if you go through the person's specification, you go through your self-assessment, what you put in your portfolio, all your achievements. So for instance, you did stuff on leadership, you did audits, you did teachings, you may have done some presentations, you did taster week. Everything you did in that portfolio, try and develop ways to talk about them, because literally all your answers to every personal question will come from that. Now, it may not be as straightforward as you expect it to be, how it was from the question banks. You can just be like asked in a very different way. I'll give you an example. So let's say in the question bank, you saw a question like, what's like, what's the disadvantage, or what will you miss? Yes, let's put it this way. What will you miss about clinical practice as compared to radiology? So getting into radiology, what do you think you're going to miss in clinical practice? And then, yeah, you have the answers of, oh, I'm not going to see as much patients as possible or as I would like. So physical contact with patients may be limited and all of that. You have those answers already prepared. But then again, the examiner can ask you, oh, what do you look forward to the least in radiology? Now, if you hear this second question I've asked you, it may throw you aback. Like, what do you mean? What do I look forward to the least? Literally, they are still asking you, what are you going to miss? Like, it's another way of still asking you, but in a different way, what you're still going to miss by leaving your current clinical practice. I don't know if you get what I mean. So the same question can be asked in different forms. And I'm saying this because these were like real experiences and real examples. So you need to have practice enough to be able to synthesize what they're asking and still know that it still revolves around those core things you've learned. So my approach will be your self-assessment, your portfolio, learn it. Develop stories around your taster week. Develop stories around your audit. Learn the things you did. Then radiology as a specialty, learn about it. Things like what's the latest thing happening in radiology. Let's say AI is a trending topic in radiology. I don't think there's any interview that you need to practice around talking about AI, for instance. Skills mix in radiology, where you have like radiographers trained to report x-rays, CT heads, and stuff like that. Topical issues in radiology, you need to learn those too. So you learn person specification like communication, teamwork, leadership. Learn examples that link to your own portfolio. So these are your examples, those are your stories. It makes you look original. And then tie everything together such that whatever you're asked. So a good way to start, for instance, would be, what are the qualities of a good radiologist? Basically, they're asking you your self-assessment. A good radiologist, you have to be a good teacher, have to be a good leader, have to be a good communicator, have to be involved in audit, in research. That's literally your self-assessment playing out, which means that if I'm answering that kind of question, I may give an introduction, yeah, whatever you want, like however you may want to introduce. Keep it simple, keep it short. These questions are not that long. Like they'll give you just 3 minutes, 2, 3 minutes for each question. So you don't have that much time, but you need to pass as much points as you can, because in the feedback, most of what they actually feedback on are the things you were able to cover. So for instance, you'll see a feedback like, oh, yeah, he did 2 audits. He led Riga, for instance. He was in a teaching program. So if I'm saying, oh, a good radiologist should be one that is very knowledgeable, he should, radiology involves a lot of medical specialties, surgical specialties, and all of that. And then you keep talking on that, and you've literally passed only 1 point across, and you've not even linked it to how you show your own knowledge. You've said something that looks beautiful, but remember that it's a tick box exercise. They also need to like tick those points that you're passing across. So you've literally just passed across 1 point and you've probably scored very low, even if you spoke very beautifully. So demonstrate good knowledge. Yeah, demonstrate good knowledge. How did you do it? Maybe you've passed MRCP, maybe you've passed MRCS. Just state it, and that's it. Move on to your next point. Should be involved in audits. Oh, I've led 2 audits. You don't need to start describing those audits in that kind of question. They most likely would, if they want you to talk about an audit, for instance, they would actually probably stop you and ask you about it. But if you keep talking about audits in that question of qualities of a good radiologist and your time is up, you've just talked about 1 or 2 points, you've scored yourself less. I don't know if I'm making sense. Like, that's how you should think of this interview. You're selling yourself. How do I sell myself? There are only like 3 forms of questions they can ask me. If they are going to give clinical prioritization station, that's 1 form of question they can ask me. The second form of question they can ask me is literally selling myself. Person specifications in the website, your portfolio, those self-assessment domains. All of that is selling myself. All of that is saying why I'll make a good radiologist in different forms. And then radiology as a specialty, the topical issues, that one, you really cannot talk about it just like that. You have to have read. You won't just know that, oh, you won't know what upskilling is if you've not read about it. You won't know what skills mix is if you've not read about it. So those ones you actually need to read from these sources I've talked about to know the substance of what you should say. So if you group it in your head into those 3 forms, there could be a clinical question if there is. They could ask me to sell myself, being a good radiologist in different forms. And then they could ask me about radiology as a specialty itself. That's it. That's actually the summary of what the interview is going to entail. But remember, you are passing all of this across in 2-3 minutes for each one, which means that you need to be articulate about what you're saying. And that goes back to when I say practice, practice, practice. Like, you can't be that articulate if you've actually not practiced. It may look like it's just I'm not. It may look like I'm trashing the issue too much, but you are tense on the day, right? You have very limited time. Everything that is going to decide if you get the job or not is happening within 20 minutes, like literally 20 minutes, which means you have to have presented your A self or your A game in that 20 minutes. You can't go against the tension. The tension is always going to be there, but if you've practiced enough, somehow, no matter the question you are asked, no matter how it's twisted, no matter how you are put on the spot, at least there's something to say. Now, the way you deliver it, that's where the practice comes in. So my own like personal thoughts and tips, I think I've covered them while explaining this, is study your portfolio as much as possible. Follow the system that works for you. So if you want to practice in a group, if you want to practice with just one person, if you want to practice in front of a mirror, if you want to bounce the ideas off your family members, friends, whatever works for you. The idea is make sure you're practicing, make sure you're getting feedback. Don't think you can give your own self feedback. You most likely like what you're hearing if you're hearing it just for yourself, but you need to bounce it off people because it's people that are going to interview you and you're not the one interviewing yourself. Be likable and clear. I put this there because when I looked at my feedback, something that I saw they put was very enthusiastic about the specialty. So I smiled as much as I could, even though I was thrown aback by a lot of the questions, but I just smiled and like gave the vibe of, oh my God, I'm so happy to be here and I really want this, if you get what I mean. And yeah, that was just how it happened. And I realized in the feedback, they actually did comment on that. So I think you should try as much as possible. Look at the interviewers as if I was the one interviewing, who would I want to be my colleague? Is it someone that is just can't be bothered, but is answering my question, or someone that is actually showing like genuine interest in what we are doing? You may think those factors don't count because it's a whole tick box exercise, but I think they do. For them to have like actually added that to my feedback, I think it does count for something. And then I put sometimes you have to be flexible with your answers. I think I've explained that. So you've practiced these answers. You've practiced, oh, what makes you a good communicator? Oh, fine. Radiology involves both written and verbal communication. Now, go straight to an example that makes you a good communicator. Try to find an example that highlights both your written aspect and your verbal aspect. So be flexible. Or you are in an MBT, how would you be able to like effectively communicate? They've literally asked you the same question again because you will be in MDTs at some point as a radiologist, but they're still asking you about your communication skills basically. So be flexible with your answers. Like try to know that an answer can actually be an answer for different forms of questions. Don't think the questions you saw in the question bank is exactly how they are going to ask you, because that threw a lot of people aback. That did throw a lot of people aback. And then be as natural as possible. That's easier said than done, to be honest. It's an interview, you're going to be tense. I think practice helps. Sometimes it may just also be personality wise, but as much as possible, I think practice bridges the gap of you being as natural as possible. I put these books here just because they give like a structure of how your answers like should be. And the structure helps because if you have a story, for instance, you know that your story should not just be sensational but pointless. Your story should actually like cover domains that actually count for something in the interview. And I think these books like really gave you I didn't use this radiology one, but I heard it's quite good. I think I used this medical interview one. But essentially they'll probably be talking about similar stuff. You just need to like know how to develop a structure, and these books are really helpful in that. And finally, I'll say good luck. You've got this, and all the best. I don't know if there are questions. Um, you can ask me possible like questions you may have seen and how you think I'm going to answer them or stuff like that. I really don't think that's like I didn't do that deliberately because I found out that there's really no one way to answer a question. That was one huge experience that I realized during the whole interview process last year. Yeah, because I had interviewed not just for radiology but another specialty, and honestly, there was one interview. There was the interview I did, and when the question was asked, like I kind of blanked out in terms of structure and improvised, and just even I was listening to myself and I was like, what the hell am I saying? But I was composed and I still tied everything together in the end. And honestly, the feedback I got, that was probably like the best feedback I got. So I can't tell you that this is how to answer a particular question. Not really, but at least always have a structure, but always know that you may have to tweak it sometimes. Sometimes nerves may get in. You may get into a situation where you just forget what you have practiced. Um, are there any interview courses you recommend? Yeah, so like I said, I didn't do I didn't do any course, but when I was getting advice for my time, I think the Radcast course was spoken favorably about. But on a personal note, I actually didn't do any course, so I don't have like a personal experience to tell you that, oh, I found this course really helpful. But those that did it told me they found it helpful, if you get what I mean. So yeah, you can explore that. I don't know if there are free courses because I think that one is paid for, probably a bit pricey, but I'm not sure what it is now. Website for hot radiology topics. So the questions itself, the the hot radiology topics are kind of limited, I would say. Like there are only a certain number of topics that are the hot radiology topics, and most of them you get from the question bank. So what you can do is the question banks have answers to those questions. If you are not clear about any of those answers, speak to someone, speak to a senior, or Google it. Like check the RCR website, just check what the official guide, like what the officials are saying about it. Especially for like, for instance, let's say the backlog of scans to be reported and the declining number of radiologists. I think there was probably a part of my notes where I actually wrote those figures down. The gap, probably, I think at the time was 3,000 plus gap of consultant radiologists. So those kind of answers, you need to get them from the official websites. Do you get what I mean? So the questions themselves are kind of limited. Like there are, I think most of the question banks, you get those questions from there, the topical issues. But the answers, what will differentiate you is you knowing what the latest view is on them. And those will be like from the official sources, from discussing with trainees, discussing with consultants. And then having your own personal thoughts to it is quite good. Don't like give a controversial personal thought on it. Do you get what I mean? Ethical scenarios. Yeah, there are ethical scenarios, which you would still see from the banks that I talked of. And the approach to the ethical scenarios, the books I shared, these books will give you approach to those ethical scenarios. So basically, it could be like scanning the wrong patient or scanning a pregnant patient. How would you approach it? Or your consultant, you smell alcohol from your consultant, how will you approach it? Those are the kind of ethical questions, and those questions actually have a structure that you need to think about. It's difficult for me to go into details of exactly how to answer like those questions, but the structures are actually in these books and in these banks. So what you need to do is be clear on how, like, be clear on the structure for it, and you can easily answer like most of those ethical questions if you already have a structure for it. So you may not have even practiced the exact ethical scenario, but you should still be able to like approach it well. So yeah, there may be ethical scenarios in the question. Sorry, I'm just trying to scroll through the messages. I'm not sure where they stop. In the interview, do we have ethical? Oh, sorry. Does one really have to work in a radiology institution to qualify for interview besides scoring high in MSRA? No, you don't have to have worked in a radiology institution. I mean, if you're talking about Tester weeks give a significant points in the self-assessment, 10 points. But apart from that, no, you really don't have to have worked. A lot of us that got into the specialty have never like actually worked in the department of radiology. But you need to show insights into the workings of the department based on your tester week. So even if for some of us that may be in similar boats as me, after my tester week, to be honest, I didn't really know much about like those issues in radiology. But you still get to like fill up that gap by reading from these banks, these courses. Like you still get to know what you should have known within your tester week, if you get what I mean, and then try to develop on that. So scoring high in the MSRA would get you an interview. That's literally the criteria to get you an interview. And then after that, your portfolio makes up 40% of your final rank, and your interview itself makes up 60%. Just to clarify, the clinical prioritization station is still so. That was why I gave a disclaimer. It's very unclear. I kept googling all the sources I knew to check for what exactly it will be this year. For instance, even the question bank I use, Medibody, they had talked about it that, oh, last year, 1 week to the interview, they brought out like clinical prioritization station. However, this year, they've actually not stated that they would give a clinical prioritization station. They literally, this was, I quoted this from the official website, 2 10-minute stations. It would cover different criteria from person specification, which will assess commitment to specialty and communication skills. That's all they stated. They didn't even talk about clinical prioritization, but that was the boat we were in last year. And then 1 week they had said, oh, fine, they're adding the clinical prioritization, which is why I said expect anything. So I don't know for sure, and they've not stated for sure that they've removed it, because even in the sample interview questions they gave, the first question was a clinical prioritization station. That's, I'm talking from the official website now, the recruitment website. The first sample was still a clinical prioritization station, and then the second sample was, all these other kind of questions. So I honestly don't know, and I don't think anyone actually knows at the moment. But again, that's why you should be part of those groups. So if there's anything that may be changing the general feeling and all, you probably have an idea, but you need to know that everything final will come from the recruiters themselves, and they're going to send like an official email to tell you what exactly is going to happen. You may not have enough time, unfortunately, like when they actually clarify everything, but that doesn't change your practice, because it can't be outside these three things I've talked about, really. Like the questions will not still be outside all of this that I've said. No matter like which angle they come from, it's still the same stuff. I don't have audits and I couldn't do a tester week, but I attended the radiology crash course. My portfolio is not so great. Yeah, so yeah, that's a good question. My advice to you is, if you do get an interview, the way I've said you should prepare for it is still how you prepare for it. Like, even though you've not done that, you've not done all of those, prepare for it in such a way that you know like everything that you need to say in terms of um, what a typical taster week may be, what, because they can ask you, describe a typical day in radiology, for instance. That can literally be one of the questions. Um, so you still need to like learn all of that stuff. And even if you've not done audits, I don't know if you've done, like, it may not be an audit, it could just be like a quality improvement project. They don't have your self as I don't think they have your self assessment, because there won't be enough time in front of them knowing like what exactly you had uploaded. So you also need to like dig deep. You may not have uploaded everything you've done. What things have you done previously that look like improving quality? Because it doesn't have to be audits that you complete the 2 cycles and all of that. It may have just been like a quality improvement project. So you need to think like, what activities have you been involved in that has improved quality in any department you've been? And why not like practice your way around that, like, and know how to sell it. So yeah, I get that you may want to feel discouraged that you don't have any of those, but if you do get an interview slot, forget about what you have or you don't have. Just think of the interview in itself. Think of everything that you have done and think of the best way that you can sell it, and just, yeah, go for it. How useful was the Well, it was very useful for me because, like I said, there was a lot of it's quite niche, the specialty, and there's a lot of new stuff that you honestly do not know. Like, I can tell you for free that there are a lot of things you are going to learn that you do not know, and you probably will not hear it. Like, there's probably no one that will tell you about all of those concepts completely. But one thing those question banks do is they've pulled together a lot of those questions. So even if they don't answer it in full details, at least you know the question, and then you can read around it to add more flesh to what you would answer to it. So I found them very useful, to be honest, because at least I knew the possible questions. I think even Radiology Cafe has like a long list of possible questions that can come out in the interview. They don't answer the questions though, but that also gives you an idea of the things you should be reading about. So a lot of I also used, I think I forgot to mention that I also like used Radiology Cafe to have a look at the questions there and know how I was going to answer those questions, because it's a long question bank there too. And it's free. Radiology Cafe is free. I don't know if I've gone through all the questions. I think I have. Um, Anything else? So my final advice would be, I wish everyone all the best. If you get an invite for the interview, forget about everything else. Don't think of, you may see your portfolio score and it may not be like as high as you want or whatever it is, but don't be discouraged. Like, just take that away from your mind. Focus on maximizing that 60%. A lot of people, I can tell you, did not really have that good portfolio scores or MSRA scores, but did so well in the interview that it really like made a huge difference in terms of ranking for jobs. So you may feel discouraged, oh, my portfolio is deficient, this and that, but forget about that. That's not the issue now. The issue is you have an interview in front of you. How best do you approach this interview? How best do you score your 60% in the interview? And it's very possible. I think was there 50%, like complete 50% in our time, or was it 49 or something? So it's like, it's actually very possible to almost have a perfect interview. Don't think it's not possible. It's subjective, but a lot of it is also objective. So you can actually max out the interview. Any other question? Yeah, that's it. All right, thank you so much. I know I may have spoken a lot, but yeah, those are my thoughts on this topic, and I wish everyone the very best.